And I'll be sharing with you a case of extraction of a failing left central incisor followed by implant placement and bone grafting simultaneously. We went ahead and utilized periotomes to immediately engage the periodontal ligament of the fractured tooth, and you can see this tooth is obviously hopeless with a subgingival vertical diagonal fracture that was subosseous on the facial aspect. Periotomes engage the periodontal ligament on the mesial and distal aspect, and then we utilized the same periotome tips on the piezo surgical device to remove the root without harming the remaining labial and mesial-distal walls. Once this is done, you can get an idea of how this allows us to remove the tooth without further damage to an already deficient labial wall. We're going to go ahead and place an implant. In this case, this is a LifeCore Prima system, tapered, threaded implant system. And we're going to place the implant within the confines of the bony housing, aiming to have the screw access going lingually through the cingulum area of the proposed restoration. Staying lingual in this case, and then it allows us going to a standard diameter 4.1 millimeter by 15 millimeter implant, allows us to engage and stabilize the implant beyond the apex area of the extracted tooth and staying lingual to the facial area of the remaining labial walls. And you can get an appreciation of this. And then going to the 3 millimeter healing abutment, we're going to attempt to do this in a modified one-stage approach. Platelet-rich growth factor is then syringed into the area, and then PRGF mixed with BioOs and Puros mineralized cortical bone is then placed into the deficient extraction site and further augment a zone of 2 millimeters of buccal augmentation to support the future implant and soft tissue scaffold. This is then fit, and then fibrin membrane from the PRGF, a BTI product, is then placed over the bone graft material and then matted and shaped into position. This material starts to set in the mouth, forming almost a saran wrap-like material over the bone graft product. We're then going to use a sandwich technique on top of the fibrin membrane using a collagen Biomend extend membrane and using Autotax to secure this membrane over the fibrin and PRGF material with the bone graft. This gives us now an added stability and a longer transition time for the membrane to stay in place during the initial healing phase. Another layer of fibrin is then placed over the collagen, and we do this in a sandwich approach to secure the fact that we'll have a great distance of time beyond 3 or 4 weeks of the fibrin membrane, but with the collagen there an additional 6 months over the bone graft material to allow for further healing. PRGF liquid is then placed again over the top, and you can see the layers of fibrin that have been placed over the collagen. Suturing of it over the top of the healing abutment, and you can start to get an appreciation of the thickness of bone that has been added to secure this implant restoration. Once again, the PRGF liquid is then placed over the healing area and an Essex-style retainer placed over the extracted tooth. We'll be showing you this case in the future to see how it's been restored and healed, and hopefully you'll come back to join us at Dental XP.